Hi, Modoma family. I want to introduce you to Dr. Jason Marchetti, our medical director here at Modoma. Dr. Marchetti is board certified in physical medicine and rehabilitation and is certified in interventional regenerative orthopedic medicine and performs a variety of interventional procedures focusing on musculoskeletal and peripheral nerve conditions. Additionally, he performs electrodiagnostic testing, which is EMG and nerve conduction studies, to evaluate patients with nerve conditions. Before we get started, you can visit modomamassage.com to take advantage of our introductory massage package, and we will talk more about that at the end as always. But Dr. Marchetti, thank you so much for joining us today. You treat a number of our patients here at Modoma, and you've seen some very transformational experiences. Would you fill us in a little bit on exactly what you do, what you specialize in, and maybe the types of patients that you treat here?
Sure. So I specialize in physical medicine and rehabilitation, which is a medical specialty that focuses on first function of the body. So we look at muscles, tendons, joints, the usual musculoskeletal regions, but also the nervous system. And as you mentioned, I do nerve conduction testing as part of my specialty as well. So I think you had a piece on carpal tunnel syndrome recently, and that's one of the things that I test for with that nerve testing. But for my background, I spent really the first at least 10 years of my career with a large spine practice, and so I was traditionally doing pain management type of procedures, epidurals, rhizotomies, even spinal cord stimulators for traditional chronic pain complaints, which was fine. It was very busy and it was a great practice. But what started really coming out in the medical literature at least 5, if not 6 years ago, was just evidence that particularly steroids and even local anesthetics, so lidocaine, marcaine, those types of medications that we use just to numb people up, what was being found was that those substances, especially at the high doses that we use, actually damage the cells, for instance, in our cartilage called chondrocytes. And we've known for years that there's side effects of steroids, and they cause thinning of the bone, and can cause thinning of ligaments and tendons over time. But it was something that really, as that evidence has continued to mount, has at least made me really question, are we really doing the right thing with our patients by doing the status quo, right? What we've been doing for years and years, these traditional steroid and lidocaine type of injections. And so I started going to a lot of regenerative orthopedic conferences and courses, and can't tell you how many thousands of dollars and hundreds of hours I've spent attending these things, just trying to learn more about, really should we be doing something different for our patients? And obviously people have heard about stem cells and platelet-rich plasma as another treatment that's been around for a long time in the regenerative orthopedic realm. So I wanted to learn more about those, and so I've spent the past 5 or more years doing that. And in 2016, I decided to really make it the focus of my practice, and I've been certified through the American Association of Orthopedic Medicine in what they call interventional regenerative orthopedic medicine, which is basically injections for joints, tendons, ligaments, those types of structures that either have acute injuries or are chronically injured or arthritic. And the hope, obviously, in the name regenerative, is to try to regenerate things, try to heal or reverse arthritis. Now, the reality is we're not quite that good yet. We're still trying to figure out the right magic sauce, if you will, to make that happen. But I wanted to at least offer patients a treatment that doesn't lead to hastening arthritis or worsening them over time. And so what I've done and changed in my practice, and really, when I go to orthopedic medicine conferences now, it's really what everyone in this space is doing, and that's really cutting back on the dose of steroids. So I'm literally using like 1/10 of the dose of steroid I used to use, diluting lidocaine to just a fraction of what we traditionally use. So instead of 1%, we might use 0.5% at most, in order to reduce that damage that occurs to those cells. The other thing I've learned along the way is that there's more to just treating a joint than treating the joint. And so I have my skeleton friend here. And, we typically think of the knee, because the knee is probably one of the most
I got it.
arthritic joints, one of the most common arthritic joints in the body that will treat. And so when you think of the joint, there's a joint space and there's cartilage, but then there's all sorts of ligaments around the knee that everyone has heard of MCL tears and ACL tears. And really, when you think about regenerative orthopedics, it's not just about, you got worn out cartilage, let's put some tissue in there to or whatever treatment in there to try to regenerate it. But at the same time, is there a reason why this joint is wearing out, particularly in patients where one knee's bad but the other's not so bad? There's a reason for that, and there's usually some sort of mechanical dysfunction. And so in regenerative orthopedics, there's a concept called biotensegrity, which basically means that all of the bones in our body are suspended by ligaments, tendons, muscles that then move those structures, and there's tension between all of those structures. And so once you have one of those pieces that loses tension, then you're losing the mechanical stability of that joint. And so part of the process is to not just put medication or orthobiologics, whatever you're using, into the joint, but to try to stabilize it by strengthening the ligaments, strengthening the meniscus in the case of the knee, and also looking at, is part of the reason why your knee's wearing out, is it because there's something going on at the ankle? Is there something going on in the hip that is then creating, a problem while you're walking? Or to borrow a term from our chiropractic colleagues, they'll talk about things being out of alignment, and that's exactly what we're talking about with biotensegrity, that, if you just have one of these joints above or below not moving properly, and it's causing you to walk in a wonky fashion, that can start to cause problems upstream or downstream. And so that really is the treatment paradigm that we're talking about with regenerative orthopedics. It's not just about what substance do you put into the joint, because that's going to change with time, especially as the literature evolves. So the other thing that I did during this my years of kind of relearning what I was doing is I wrote a book, and it's an electronic book or ebook, and it's called A Buyer's Guide to Stem Cell Treatments. And I wrote that in 2017. It's still available on Amazon. It's I think it's $4, something pretty inexpensive. But I wanted to really give people some background as far as what are these different treatments that they hear about. When they see an ad about stem cell treatments, what does that mean? Because you'll have some people who they're talking about getting a vial of amniotic tissue or umbilical cell tissue, and they'll call that a stem cell procedure, and they'll charge thousands of dollars for it. And some of those products don't have a single living cell in them. Other people, when they talk about stem cell procedures, they're talking about taking your fat or your bone marrow, spinning it, and injecting that, which again, that has some stem cells in it, but it isn't a purified stem cell product. And in fact, nothing we use in the United States outside of some very specific studies is really truly a cultured stem cell type of product. So with that said, that's the reason I wrote the book, was to give people kind of a very easy understanding as far as what are these different treatments, what do they need to look at, what do they need to scrutinize, and what questions do they need to ask when they're considering those types of treatments. And like I said, it's a very basic overview, and now it's a couple of years old. There's several studies that have obviously come out. The literature's changing all the time in that realm.
Yeah, wow.
So when I treat patients here at Modoma, obviously they're patients who have a variety of pain conditions. Usually it's somewhere in the spine, but also in the peripheral joints. So I guess one thing I'd like to know from our audience is what sort of topics they would like to hear about in the future when we do future videos like this. And some thoughts that I had are just different spinal conditions. For instance, one question I frequently hear from patients is, when do I need spine surgery, or what sort of things do I need to worry about when I really need to go get an MRI scan, or I really need to see a spine surgeon. And so those are topics that are fairly easy to cover as well. There's also new and emerging treatments. There's a medication called low-dose naltrexone. There's injectables that are called peptides. There's always orthobiologics coming out. Some of the ones coming out now are called liposomes, which are kind of a stem cell type of product. So any of those types of treatments we can cover. The other thing that I've also started appreciating and treating more in my practice is the fascia. And we talked about joints, ligaments, tendons, that kind of thing. And obviously in the spine we have nerve roots, and we do epidurals and those types of things. And sometimes those are still appropriate to do. But oftentimes, especially when we have folks who have like upper back pain around the shoulder blades, there's so many muscles there that are interacting with each other, and there's so many nerves that travel a long distance to get to those muscles that actually get entrapped in the fascia. And the fascia is the connective tissue around the muscles that now with modern ultrasound units, we can actually find those fascial planes, find where those nerve branches are, and do what's called a hydrodissection treatment, where we put the needle into that area and basically expand this plane between the fascia and the nerve to try to treat some of those conditions. And so those are just some of the tools in the toolbox, so to speak, for treating a variety of conditions.
Yeah, wow. Well, we're so well taken care of, not only by Dr. Marchetti, but by our medical team as a whole, and by our wonderful LMTs who are so highly trained and here to customize everything to meet your needs. You guys can visit modomamassage.com to get started with your introductory massage package. That's where it starts. And we just have a variety of services that we're able to offer because we are a medical clinic, and we also look at your body holistically to make sure that we are moving in the direction to get you the best wellness and path to healing. So thank you so much. Again, I'm going to put in the comments a link to Dr. Marchetti's book. And we would love to hear any further topics that you would like to hear about. A certain area of the body that you're having pain, a question that you have about it, anything that you feel like that you want us to cover in the coming weeks, please let us know. So thank you again, and you can visit modomamassage.com to get started. You guys have a wonderful day. Thank you, Dr. Marchetti.
Thank you. Appreciate it.